Welcome once again to the series. Today I'm going to be talking about the picture test and your preparations towards the picture test. Picture tests are quite interesting in medical school, and I see medical students. I've been there before. I will see the way you guys prepare for the exams. You have loads and loads uh of pictures, on your laptops, and you keep studying them over and over again. It's good for you to study those things so that you can, we don't study only for the exams, we study to know. So, for example, if you have a book that contains 500 medical equipment, 500 medical equipment, you have a book that has pictures on different clinical scenarios and clinical diagnosis, and you go through them, that's perfectly fine. But here is the catch. We don't take our pictures from those books. So, which is why you guys will spend the whole night reading, and I see you even on the day of the exam, right in front of the examination hall, you guys are going through those pictures. None of those pictures are going to come out in the picture test. The pictures that we use? They are pictures of patients we see with you in clinic, not the ones on the internet. What's the lesson here? When you are in clinic, pay attention. I always tell people, when you are in clinic with me, for example, because I see loads and loads of patients, it may feel like there's just a little bit, if just a few minutes to pass information across, but you must pay attention. When you see a patient with a goiter, you must see that this patient has a goiter. You must, because you never can tell whether it's that picture that is going to come out in your picture test or something similar. When you're in theater and we are operating and you see cases that we're operating on, those are the pictures that we take. Those are the things that will come out in your picture test. Once you pay attention and you know the clinical scenario, sometimes you even just know the diagnosis because you already know, we saw this patient together in theater, we saw this patient in clinic. Now, in answering the picture test itself, make sure you are sitting at a point in the exam or where you can see clearly. If you can't see, raise up your hand. We are going to change your position. We are not wicked people, right? Sit down where you can see clearly. Make sure that once the question is flashed in front of you, you are ready, you are not distracted. Now, what do? The first thing to do is scan the questions. So usually your picture test may be 2 minutes, sometimes 3 minutes. Once you see the picture and the questions, within 10 seconds, you should be able to scan the questions and see, what's the diagnosis? What are the things you are looking out for? What is the management? And then you go to the picture. That way, when you are looking at the picture, you already have a mindset to answering the question. It's not just you staring at a picture without even knowing what might be required of you, and then after that you are going to the questions. The likelihood is that you will then have to go back to the picture again. So make sure you scan through the questions first before you go and look at the picture. That will help you in saving a lot of time. Be clear in your answers. Don't gamble. When we are marking picture tests, if we say list 5 things and you list 10 things, you are only going to mark the first 5. So if the first 5 you wrote are wrong, that means you are going to be scored 0. Because it's not a gambling exam where you say, if this doesn't work, this will work. Make sure that you are sure of your answer and you write clearly. Many times I see funny things. There's a picture of a kidney and somebody is saying something completely different. Maybe you say there was a picture of a kidney and some people said this is the picture of the breast. How does that tally? There are too far apart. That just shows a candidate that has not been paying attention in class. So you shouldn't be that kind of candidate. The picture tests are supposed to be very easy. Once you pay attention to those things, these things I'm saying, you would likely pass the picture test. If you have any questions, let me know. All the best.